A warm welcome to you. My name is Marie Ambo, and definitely this is Health and Lifestyle, where we talk all matters health. Now, to interact with us, our social media platforms at KBC Channel 1 on X and KBC Channel 1 TV on Facebook is where you can interact with us. Now, for over 1,000 people in Kenya, a simple injury can turn into a medical emergency. Hemophilia is a rare inherited bleeding disorder that is often misunderstood and misdiagnosed. Today we speak to one of the people affected, including a medical expert who will explain what causes it. But before that, a look at what's coming up.
I was referred to Kenyatta National Hospital. That's where I was diagnosed to be a hemophilic patient.
One cut, endless bleeding.
A woman has got two X chromosomes. So there is the defective X chromosome, which is the one that now transfers the genes that cause hemophilia to the next generation.
Passed down through generations. With hemophilia, prevention is power. More in the good practice segments. And to our first segment. Charles was just a newborn when he was diagnosed with a bleeding disorder. What was meant to be a routine circumcision turned into a medical emergency because the bleeding wouldn't stop. Charles shares his journey with hemophilia. A few months after his birth, Charles Njogu's parents began to notice something was wrong. Bruises appeared from the gentlest bumps, and minor cuts would bleed unusually long.
6 months after the birth, that's when I started to have bruises under the armpit. The knees started swelling. If I pray, if I fight with other boys, I have to swear to have bruises everywhere.
It wasn't long before they got the diagnosis.
We started the journey at Murang'a Hospital. But at Murang'a, they did not know what's happening to me. I was referred to Kenyatta National Hospital. That's where I was diagnosed to be a hemophilic patient.
Hemophilia is a rare bleeding disorder in which blood does not clot properly. Growing up was anything but normal. Teachers knew never to cane him, and he was shielded from physical activities.
So I had to be told, you are not supposed to pray, you are not supposed to do this, so that you don't get injured, and not to be in the wrong side of teachers, because I will be beaten, and the next day I cannot go to school. If you pinch me, the following day you will find I have bruises.
But the real test came during a crucial cultural milestone, circumcision, a rite of passage from boyhood to manhood.
That was the worst, because I knew very well I'm hemophilic, but we tried to seek information from medics. They advised us that mine will not go as the other boys who were being circumcised in the morning and went home at the same time. Me, I was circumcised around 5 a.m. So I had to be observed from 5 to 10. That's where the doc said, he is not bleeding, he is okay, he can go home. Everything was well until I slept. Around midnight, 1 to 2 there. That's where I woke up. I find myself very wet. I thought I was in dreamland, the dream that always will be fulfilled. But nikatoka nikaenda kuangalia, only to find out that it's blood. My bed sheet were blood. I was rushed to Murang'a Hospital, where they tried to infuse me with blood, whole blood, fresh from, which was also dangerous to me. But because there was no factor, no cryoprecipitate, it's only the whole blood that I can be infused.
The small facility lacked the cryoprecipitate he urgently needed to stop the bleeding. His life hung in the balance as he was then rushed to the Kenyatta National Hospital.
Between Kenyatta and I had to collapse due to now I am getting pale because of the blood. I lost a lot of blood. I was transfused a lot of blood and it's not helping. So I was rushed to Kenyatta. Luckily I found that there was cryoprecipitate and blood plasma.
Cryoprecipitate, also called cryo, is a portion of plasma, the liquid part of the blood. Cryo is rich in clotting factors, which are proteins that can reduce blood loss by helping to slow or stop bleeding. The blood clotting proteins found in cryo include fibrinogen, factor 8, factor 9, von Willebrand factor. Charles lacks factor 8.
Like me, I'm a hemophilia A severe. I lack factor 8, which is clotting factor 8. That sequence is actually like this, from factor 1 to 13. So when you remove factor 8 or factor 9, the person will bleed simultaneously.
His survival is nothing short of a miracle, he says, explaining some of the side effects of this disorder.
The blood is coming out and it is internally. So it's trying to fit there. So you have to swell. I got bleeding in this joint. It was damaged. So at the end. This one I can move. Yeah, this is the end here. So, but stretching at the end, the same.
Most cases of hemophilia are inherited, passed down from a parent. Because hemophilia genes are passed down on the X chromosome from the mother, males with hemophilia are much more likely to have serious bleeding symptoms than females.
In our family, we are 3 who have hemophilia. One alikufa juu ya bleeding kwa tumbo, mwingine alibleed kwa kichwa. At the age of the one who bled to head injury, alikuwa 32, that one there. The other one was 18, 19. So my 2 girls, they are carriers. Automatically they are carriers. My boy is okay.
Now he's using his voice to spread awareness.
It's not about witchcraft. Sometimes they say he bred because he is a coward. Alikuwa naogopa. That's why alibreed. No, it's a genetic disorder. A person with, having a hemophilia, to the extraction, he will bleed a lot. When, what do we call it? Hii kitovu isipoangaliwa vizuri, also atabreed sana. Akienda injection, hizi BCG, we call them BCG, those atafura tu. Because a hemophilic, you are not supposed to have intermuscular injection.
Blood donation is the most precious gift. Its components, the red blood cells, platelets, and plasma, can be used individually for patients with blood disorders.
The clotting factor will be extracted from there, or cryoplasma from your blood. That cryo and plasma, they will help a person with a bleeding disorder.
On that note, we take a break, but we'll be back with much more, including a medical expert explaining more about hemophilia, and later on our good practice segment, the do's and don'ts for hemophilia patients. Welcome back and thank you for staying with us. Now, hemophilia mostly affects males and is often passed down from mothers who carry the defective gene. Dr. Joshua Gishemo is a specialist in bleeding disorders and explains how this happens.
Hemophilia is a blood clotting disorder in which a patient suffering from hemophilia will have prolonged bleeding. There is a short duration in which the blood must clot, but in these patients it is prolonged. Why? Because they lack the clotting factors in the body which are able to facilitate the clotting. So we have two most common types of haemophilia. We have haemophilia A and haemophilia B. Haemophilia A is a deficit in the factor 8 of the blood clotting factor, and then haemophilia B is a deficiency of factor 9. So you have the severe is less than 2% of clotting factor in the blood. Then you have the moderate, which is between 2 to 5%. And then you have the mild, which is now 5 to about 40% of the clotting factor in the blood. What differentiates this also is how it presents. You will find that there are patients who, with the ones who are in severe, they can bleed any moment. They can bleed in any moment, but then you find that in those who are in mild, they bleed when they undergo some traumatic condition. They are playing and then they get hit, or they get a cut, sustain a cut. That's the big difference. So you find those who are mild is mostly during traumatic conditions, and those who are severe, they can bleed anytime.
Between the two, hemophilia A and hemophilia B, which one is more severe? Or could I say which one is more dangerous than the other?
Well, they are both dangerous. We may not have established studies to show that this one is more dangerous than the other. What might be different is the kind of treatment that is given. They both need factor, and it's the factor that is deficient. If it's hemophilia A, they are given factor 8. If it's hemophilia B, they are treated using factor 9. Another thing that may be different in our setting is the availability. So you may find that in the setting probably where I work, I have factor 8 in abundance, and factor 9 might be a bit scarce. So you find that those with factor 9 may be facing challenges in accessing it. Yes.
So hemophilia is a blood clotting disorder. But I'm sure the question that people have in their minds then, how long should blood take to clot, so that you know whether you have a disorder, if it takes too long, or can I say it takes too short, a shorter time?
Generally, the blood takes should be about 7 minutes or so to clot. Yes. In patients with hemophilia, this time is prolonged, so they could bleed endlessly.
So now, what causes hemophilia? Is it genetic? Is it possible for someone to get it later on in life? How does it come about?
Well, hemophilia is a genetic disease, and this means that it's a condition that a patient carries for a lifetime. It is caused by it's a genetic disorder which is passed on by the mother. Why? Because scientifically it is an X-linked chromosome disease. That means that the X chromosome is the one that the mother passes on to the next generation. If you see in a man, the man has got the X chromosome and the Y chromosome, and the mother has got X chromosome only. So hemophilia, as you notice statistically, affects predominantly the male child. Why? Because it's the X chromosome in the boy child that carries the hemophilia, the defect. Yes. So in women, what you are going to find is that they are carriers. What does a carrier mean? It means that in the two X chromosomes of a woman, one of them is the one that has the defective gene.
Having talked about hemophilia, it being genetic, and you don't have really control over it, but do we have control over its treatment?
Yes, hemophilia is a treatable condition, and it's a lifetime condition. So it means that they'll have to be continually in their lifetime. They will have to undergo treatment all through their life. Yes. So depending on what factor is deficient, if it's hemophilia A, we treat them using the factor 8 replacement. So whenever they have a trauma, on-demand treatment, we call it on-demand treatment. So when they have a traumatic event or they are bleeding, they come, we administer the factor 8. If it's hemophilia B, we administer the factor 9. Also, we have now advanced the treatments. Progressively, we have had improvements in the treatment of hemophilia, which now, whether hemophilia A or hemophilia B, we're able to give what is preventive treatment. Yeah, to prevent them from bleeding. Yeah, so usually they come periodically, once a month they come, we administer them the treatment, then they come progressively on. And we discourage patients with hemophilia in engaging in work that requires a lot of effort, or in our language we call it exertion. So anything that involves lifting, heavy lifting, physical exercises to some extent, depending on the severity, we highly discourage them from undertaking those activities. Why? Because it often results into bleeding. Yeah. Then there isn't much change in diet. So dietary, in terms of eating, there is not much to say about it. But in terms of their physical activities and their career choices, will be significantly affected. So there are jobs that a hemophilia patient cannot do, no matter how passionate they are. There are exercises that they cannot do or engage in some sporting activities. There are some of them will highly discourage. Yes.
So hemophilia being genetic, that means you're born with it. How then can, a mother for that matter, or parents, be able to identify, hemophilia right from the time a child is born? So maybe you could speak to us about some of the symptoms that parents need to look out for to identify it very quickly.
The most common thing that a mother should be looking for from the time of birth is a child who is bleeding. When they get hurt, they get injuries, they bleed for a very long period of time. And also they have repetitive injuries that do not recover the way a normal child would recover. So that alone should cause a mother to take the child to the hospital for assessment and testing and confirmation of whether it could be a bleeding disorder or any other thing. Then the other thing, that if they don't have any wounds that are bleeding prolonged in a prolonged manner, the mother needs to identify if maybe there are swellings on the joints or on the muscles. Maybe they get pricked, they go for the usual, the routine injection vaccinations, and then the child has these swellings that appear on the skin. They are dark swellings and they don't seem to resolve within any expected duration of time. They should also suspect that child to have a bleeding disorder and will need to be checked. In Kenya, so far we have about 1,000 patients diagnosed. But we know, according to the statistics that we are working with, we are likely to have about 5,000 hemophilia patients suffering from hemophilia. Where are the rest? We need to bring an awareness so that they realize that it's a condition that can be managed. Let them come to the centers, they get tested, they get diagnosed, and they get treated.
For hemophilia patients, prevention is power. And so on the Good Practice segment, we look at the do's and don'ts for hemophilia patients. Take a listen. Special care is recommended for individuals with hemophilia to help manage the condition safely. Avoid injuries and try and stay away from rough sports or activities that could lead to cuts, bruises, or internal bleeding. Choose low-impact exercises like swimming or walking. Joint bleeds are common. Wear protective gear like knee pads when needed and keep a healthy weight to avoid putting too much pressure on your joints. Be cautious with medicines. Patients with hemophilia can never use blood thinners. Why? Because blood thinners are meant to stop blood from clotting, and they already have a clotting disorder. Don't take medications like aspirin, warfarin, heparin, and others, or ibuprofen unless under doctor's instructions. Consult your healthcare provider before taking any herbal supplements, as some may also affect clotting. Blood clotting factors are usually given to hemophilia patients before and after surgery to prevent excessive bleeding. Always follow your prescribed treatment routine. Keep factor replacement medication or other treatment on hand and know how to use them in an emergency. And let others know. This helps if you're in an accident or can't speak for yourself. Gum bleeding can be a problem, so brush gently, floss carefully, and see your dentist regularly. And tell them about your condition in advance. Regular checkups with a hematologist or specialist help you stay on top of your health and adjust your treatment if needed. On that note, we've come to the end of the program. As always, thank you so much for your time and for interacting with us. Remember, if you've missed any part of this program, you can always watch it on our YouTube channel. My name is Marie Yambo, and on behalf of everyone who made this program possible, definitely our guests, the patient, that is Charles Njogu, and Dr. Joshua Gishewu, thank you so much for your insightful information. And of course, the production team. Remember, we are always here every Sunday, 6:30 p.m. And so I hope to see you again next time.